Hi everyone, it's Avi Thomas and I'll be presenting about Dorothy Johnson, nursing theorist, educator, and author. Alright, so here is Dorothy Johnson looking super smart. Today we're going to talk about her biography and timeline. We're going to talk about her contribution to nursing, which is the behavior system model of nursing, and applicability to current practice. Dorothy Johnson is on the right. She was born in 1919 in Savannah, Georgia. She obtained her education from Vanderbilt and Harvard. She worked most of her life at the University of California as a professor. In 1968, she proposed the behavior system model of nursing, and she published the book Barriers and Hazards in Counseling in 1970, followed by the theory development What, Why, and How in 1978. She retired in 78 and she passed at the age of 80 in 1999. The behavior system model of nursing. This concept was introduced by Dorothy Johnson, where the patient is defined as a behavioral system composed of 7 behavioral subsystems, which we'll go over in the following slides. It's our role as nurses to help our patients maintain a balance between these subsystems. This will work best during the assessment and evaluation portion of our interaction with the patient. That's where we can actually see them balance and look at areas that we can influence. These are the assumptions made about the system, the structure, and about the functions. On the left-hand side, there are 4 assumptions about the system in the model. Number 1, that all of these make up the system. Organization, interaction, interdependency, and integration of the parts and elements of behaviors. Number 2, that a system tends to achieve a balance and a man strives to continually maintain that balance. Number 3, that a behavioral system is essential to man. And number 4, that system balance reflects adjustments and adaptations that are successful in some way and to some degree. On the right-hand side, these are the 4 assumptions about the structure and function, and that includes the concept that each individual has a tendency or a predisposition to act a certain way, and that each subsystem has a repertoire of choices called a scope of action. So here are the goals of nursing according to the behavior system model. Number 1, to assist a patient whose behavior is proportional to social demands. Number 2, to assist a patient who is able to modify his behavior in ways that it supports biological imperatives. Number 3, to assist a patient who is able to benefit to the fullest extent during illness from the physician's knowledge and skill. And number 4, to assist a patient whose behavior does not give evidence of unnecessary trauma as a consequence of illness. Remember on slide 4, we spoke about how the patient is the behavioral system, and there were 7 subsystems that go under that. So these are the 7 subsystems, and as we go through this, I'll explain it from a perspective of a staff RN. Let's say today you're working at a med-surg unit and you're assigned a patient named Mr. John Doe. And Mr. Doe was admitted for right leg cellulitis. As you're admitting him and assessing him, you notice that he was, number 1, with the ingestive subsystem, that he looks severely malnutrition. So this is a conversation that you can have with your team and possibly get a dietitian on board, or relook at the caloric intake diet or caloric intake needs. Number 2, eliminative subsystem. So you also find out that he hasn't pooped in 7 days. Do you think that this will affect his overall stay at the hospital? We need to address that constipation. Number 3, you also find out with affiliative subsystem, you also find out that he hasn't talked to his wife for about 3 months now. And number 4, dependency subsystem, you find out that he depends on his daughter a lot. She's been doing all the cooking, laundry, folding the clothes, and he leans on her a lot for emotional support. And you're looking at him and he's mobile, steady gait, and he's able to do things on his own. Number 5, sexual subsystem is out of the window because he hasn't spoken to his wife in a while. Number 6, aggressive protective. You find out that he stopped taking his blood pressure meds about 3 months ago because somebody told him it will kill him. So he's kind of jumpy about medications or anything new about his care. Number 7, he hasn't had a sense of achievement because he's been dependent on his daughter a lot. So with all of that, do you think that his subsystems are in balance? If you said no, you are correct. This is an illustration of the 7 subsystems that we spoke about. On the left-hand side, you see the behavioral disorder that's associated with the biological illness. And we as nurses help them maintain that equilibrium or that balance of their subsystems in the hopes that they achieve optimal health. So I can't click on this right now, but if you have some time, pull this up from Blackboard and click on the link below. This is a hilarious skit made by several students demonstrating what each subsystem entails. And they even have someone dressing up as Dorothy Johnson. Overall, Johnson's theory could help guide the future of nursing theories, models, research, and education. By focusing on behavioral rather than biology, the theory clearly differentiates nursing from medicine. So focusing on behavioral instead of just biological works, it can be an asset. In order to focus on a holistic idea of nursing, it's important to think of the behavioral and biological together as health. If a nurse is able to help patients maintain that equilibrium or balance of the behavioral system through an illness in their biological system, then he or she has been successful. Here are my references. Let me know if you have any questions. Thank you.